Does it anger you when you see patients who you're diagnosing them at stage 3B or 4, and they're telling you that their GP kept on saying, no, you don't need one, you've got no symptoms, there's nothing in the family. How do you feel?
Well, thankfully it doesn't happen that often. And I've spoken about the Worcestershire effect before, which is the people of Worcestershire are well educated in the main, are health seeking, they're proactive about their health. They do ask for PSA testing, or their wives or their daughters ask for dad to be tested. So it does happen, but you're right, I have met patients who wished that they'd been tested earlier. Also, the Worcestershire effect means that the GPs that I work with and alongside are usually very, very good GPs who are trying to stay on top of a very difficult workload, but still delivering the best that they can in very hard circumstances. I think to counsel somebody about PSA testing takes about half an hour, minimum. And then they need to go away and think about it. And we just aren't furnished with the time to do that. So if you're going to offer a PSA test to a man over the age of 50, it has to be an informed choice and an informed discussion. So I don't think any man should be denied access to a PSA blood test if they're informed and understand the pros and the cons. But I don't think that's happening. So that's already an issue at the beginning of the journey before the needle goes into the arm. Does the man know what the test means? Does he know what the consequences of an abnormal test could be? And I've seen lots of patients who sometimes that wasn't so clear. So we have to intercept the story right at the beginning, and we have to also look at a number of things that have changed in the landscape. So we know that if your dad's got prostate cancer, then you're at higher risk of developing prostate cancer, so maybe you should be tested a bit earlier than 50. We know that if you're black or of African descent, that you've got a serious risk and you should be checked sooner rather than later, maybe before the age of 50. And then there's other things which haven't yet evolved fully, but genetic testing for the BRCA gene and widespread investigation of the role of that still isn't clear. So there's loads of things that still need to be sorted out before the needle goes in the arm and what we're going to do to who. But I remember very clearly when I was a junior doctor that patients with advanced prostate cancer, their prognosis was not very good. It was around a year to 2 years. It was medical or even surgical castration, and that was it. But in the modern era, there are new agents now, and I would say that somebody with advanced prostate cancer can survive for easily 5 to 7 years, if not longer. So there's been a complete change. And also the change around heart disease, diabetes, hypertension, correcting other tumours means that the adage that you will die of something else as opposed to your prostate cancer does not apply anymore. But we still hear that line is trotted out. It does not apply. People used to die of heart attacks and strokes all the time. That isn't happening. People are having coronary artery stents and heart surgery. They are living active lives for many years after that event, and their heart attack, which was going to kill them, has been prevented. So the prostate cancer becomes a more important actor for that patient in their later life, and that's something I think people have completely missed. So treating older men is becoming much more important, and men are living much longer in Worcestershire. I see men aged 95 still driving, playing golf, wanting to have active lives. I know that if they are diagnosed in their 80s with prostate cancer in Worcestershire, they'll be offered aggressive, active treatment. But in other parts of the West Midlands, they will be told, don't worry about it, have some hormones when your PSA reaches 20. A completely different way of dealing with prostate cancer in this county.
Thank you very much indeed. Right. What I'm going to do is this. We've got some more questions to ask, but so that you know that it's not going to go on through the night, that we'll wrap it up in 15 minutes' time from now, okay? If I can just add a question at this point, and that is,